Today we'll share some very practical tips on how to take care of yourself when living with angina so that you can keep your heart healthy and happy. So angina is the chest discomfort or pain that is caused when your heart muscle doesn't get enough oxygen. It's usually a warning sign of an underlying health issue, usually due to the fact that your arteries are narrowed or have been blocked. While that may sound scary, with proper care and a few lifestyle adjustments, you can manage angina really well. And one of the keys to managing angina is knowing what triggers it. Angina attacks often happen when you're physically active or under stress, even when you're exposed to extreme temperatures. So I recommend, if you have this disease, to keep a simple diary where you note down when you feel any sort of discomfort, what you were doing at that time, how long that discomfort lasts, and that way you know what to avoid. There are also a lot of lifestyle changes you will need to do because, again, angina is what comes before heart attack. So you want to focus on a healthy diet. Make sure you're eating heart healthy foods that have a lot of fruit, vegetables, whole grains, lean proteins, and healthy fats. Reduce any sort of salt or saturated fats that can increase your blood pressure or your cholesterol levels. You also want to make sure you incorporate a lot of activity. So make sure you're walking around, swimming, or even doing yoga or anything that can strengthen your heart. Just make sure you pace yourself. If you know that a brisk walk can trigger symptoms, then take a few breaks along the way. Stress is another major trigger. So whether it's through meditation, deep breathing exercises, or even hobbies like gardening, baking, crocheting, find a way to relax, and that can make a significant difference. And you will need to stop smoking and limit alcohol intake. If you smoke, you'll have to quit it completely. And because angina is what comes before a heart attack, you may get medications to help manage that. So making sure that you adhere to the medications that your doctor prescribes is key to ensuring that you don't get a heart attack. And it's not just getting the medications. You'll have to do regular checkups with your doctor just so they can make sure that there is progress. You'll also have to learn how to self-monitor, so how to check your pulse and be proactive about your health and how to measure your blood pressure. All these things are things that can help you make more informed decisions about what could be a possible trigger, or even alert you if your heart is not working well or if your heart is working too hard. So if you have angina, what you have to do is just make sure that you identify your triggers, you make healthy lifestyle changes, you stick to your medications, and you stay connected to your healthcare team. If you found these tips helpful, give this video a thumbs up and subscribe for more heart health guidance. Stay healthy.